All right, and we will get started. So again, thank you so much for being here to learn more about the RFP that the New York State Office for the Prevention of Domestic Violence just released. The title of the RFP is Gender-Based Violence and Developmental Disabilities Training and Resource Development Services. And just like this picture shows two people collaborating, that's what we're really looking for. We're looking for a partner to collaborate with us on developing curriculum for trainings, developing resources for providers, and then co-facilitating those trainings as well. So I'll get into a lot more information as the presentation goes on. Our agenda for this morning, welcome and introductions. I'll give a brief overview of the New York State Office for the Prevention of Domestic Violence, OPDV, and the collaborative project. It's a collaboration between Office for the Prevention of Domestic Violence and the Council on Developmental Disabilities. We'll go through the goals of the RFP. We'll talk about the proposal content, submission, and evaluation, and I'll talk with you a little bit about questions that you can ask and how to go about that. Before I go any further, I will tell you a little bit about myself. So my name is Kelly Weiss, and my pronouns are she, her, and hers. And I've been working on this collaborative project for almost exactly a year. I started in the beginning of March of 2023. And prior to working on this project and coming to OPDV, I worked in disability services for the past 20 years. And I had a lot of different roles throughout those years, as many people do. But most recently, and really for much of my career, I worked at a college program for students with disabilities. And it was in that position that I got very involved with sexuality education and violence prevention programming because there was such a need for it. So many of the students we were working with did not, didn't have any prior education at all on these topics. And we saw some really concerning things. So I became very passionate about this topic of violence against people with disabilities and about the lack of preventative work around sexuality education and violence prevention programming, not only because I think it's so important, but I also really felt that not enough was being done to address it. So when I saw this project, it was just a great fit for me. So that's what led me to this project and to OPDV. Any questions that you have throughout the presentation, please post them in the chat box. We won't be answering any questions this morning. We will be posting them at a later date, but feel free to, throughout the presentation, as things occur to you, to just go ahead and put them in the chat box. And before I go any further, I'm actually going to interrupt myself because I forgot to give a physical description of myself, which I like to do to increase accessibility of this presentation. So I am a white woman in my 40s. I have long dark hair. I am wearing a black blouse. Behind me is a black frame photo, and I have a window next to me with the sun coming in, which is quite lovely. You can also submit questions after the webinar. So again, throughout the webinar, feel free to put things into the chat box, or you can send any questions you have to OPDV, GRP, RFP info@opdv.ny.gov, and please submit any questions by March 19th. And I'll go through at the end of the webinar important dates to keep in mind that are also listed in the RFP, and I will show this email address again. So I want to give a brief overview of New York State Office for the Prevention of Domestic Violence and the collaborative project. So New York State Office for the Prevention of Domestic Violence is located in the Alfred E. Smith building. You can see it in this picture right here. We are located right across from the Capitol, and it is lit purple in October for Domestic Violence Awareness Month. New York State is actually the only state in the nation that has a cabinet level agency that specifically addresses gender-based violence, including domestic and sexual violence. This really is a statement of New York State's priorities. And OPDV addresses gender-based violence through public policy, public awareness and education, and we also partner with a statewide network of service providers. OPDV ensures that all work is survivor-centered, trauma-informed, and culturally responsive. So I just want to talk for a moment about what each of these terms means. It's incredibly important to all of the work that we do. You'll see it all throughout the RFP. It's going to ground all of the curriculum we develop and the resources. So I just want to spend a moment talking about what what it means. So being survivor-centered it's the idea that the survivor, the person, is making all the decisions and making all of the choices. There's so much power and control is taken from a person when they've been victimized that is so important to give as much power and control back to that person. That they should be defining even what this experience is and what they need. They will define and prioritize their needs, and it's our job to respond to those needs that they have identified. Now, with survivors with developmental disabilities, how this might look is that the survivor decides, if they want to support staff involved in accessing services, well, they decide exactly how that looks and what they need. So maybe they just want to talk with somebody ahead of time about what to expect. Maybe they want somebody to go with them to access services, but maybe wait in the waiting room, or maybe they want someone right there with them. And the idea, you get it, is that it's up to the person what kind of support they get in seeking services, and that's just an example. Now, trauma-informed is the idea that we acknowledge trauma is so common that we interact with all people with compassion so as to not re-traumatize. It's an awareness and looking for signs and activators of trauma as well. So for someone with a developmental disability, it's really, looking for signs of trauma, because what can happen at times is that these signs of trauma can be mislabeled as a characteristic of the disability. And so then the trauma is completely missed and not treated. Culturally responsive is the idea that we are approaching individuals in a holistic way. So however different identities different ways that somebody might identify and the ways that those things overlap and intersect, we want to provide services in a holistic view of a person and how they identify. Now, for someone with a developmental disability, culturally responsive services would be, an example would be that services are inclusive and accessible for survivors with disabilities. So the collaborative project, it's a collaboration between New York State Office for the Prevention of Domestic Violence, OPDV, and the Council on Developmental Disabilities, CDD. And our goal is to develop and implement capacity building to increase accessibility for survivors with developmental disabilities, for developmental disability providers, domestic violence providers, and rape crisis programs. And we're going to do that through training and development, which is why this image on the screen shows two gears intersecting with those terms on it. I just want to talk for a moment about why we are doing this project and sort of put it into context. Now, I realize that most people on this call are probably very aware of this, but I like to remind us of why we are doing this. And it's because there are extremely high rates of victimization for people with disabilities compared to those who don't have disabilities. So someone with a disability is 4 times more likely to be victimized than somebody without a disability. If somebody with a cognitive disability is 7 times more likely to be a victim of sexual assault. And if you're a woman with a cognitive disability, you are 12 times more likely to be a victim of sexual assault. And that is just the cases we know about. And while it's very common for there to be many unreported cases of assault and violence, there are even more unreported cases for survivors with disabilities, because oftentimes there are unique factors that make reporting challenging. You have these extremely high rates of victimization, and yet you have very few survivors with disabilities that are actually accessing domestic violence and sexual violence services. Only 13% of survivors are accessing these services. So there's a real gap, there's a real disconnect. So we want to bridge that, absolutely. And so I'm going to talk next about where we started with the project, where we are now, where we plan to go, and I'll explain where the RFP comes in and the organization that we're looking to consult with. So the first thing that we did was we identified stakeholder groups. So this would be, people with disabilities, survivors with disabilities, self-advocacy groups, developmental disability providers, domestic violence providers, rape crisis program providers, parents and families. These are our main stakeholders, although we foresee interacting with other groups in time, because really what we'll need to do is interact with any stakeholder group that any survivor interacts with. But this is our immediate focus. So as I mentioned, we want to develop training and resources for these providers, but we thought, well, first, before we do that, we should really talk with all these different groups and find out what it is they need. What are they seeing? What is the climate out there? What would be helpful to them to include in trainings and resources? So we called them learning exchanges. They were like listening sessions. And basically, it really was a learning exchange because while I gave some information about the problem of violence against people with disabilities and about the project, I really turned it over to the participants and was curious what they had to say and what their perspectives were and what they needed. So we developed all that content. We hosted learning exchanges all throughout New York State. We just recently wrapped them up, although I'm still doing some here and there as the opportunity presents itself, just because it was incredibly helpful. We got so much information. While we saw some themes that emerged throughout, some things that just sort of kept coming up, in each learning exchange, there was also new information that emerged. So it was incredibly helpful. From these learning exchanges, these listening sessions, we've taken that data and now we're developing recommendations based on what people have told us and what we've observed ourselves during these learning exchanges. Those recommendations are going to help inform the training and the resources that we then roll out. So I'm very excited we're at this stage in the project where we are ready to start developing these trainings. We've been preparing for a year for this, and now we're ready to find a partner to help us with it. So we're all really excited about it. So that's what the stage we're at right now is we are now going to be developing these trainings and these resources. So that is the moment we're in because our focus right now is on the providers. That is because, unfortunately, we are in a reactive moment right now. We have so many people that are getting hurt and they're not getting the help that they need. So we need to immediately, this is, I've said this many times, and I really don't think it's an exaggeration to say that we are in an emergency situation right now that needs an immediate attention. So that's where we're focusing. Once we feel that providers, feel confident, they feel equipped to support survivors with disabilities, then we can shift our focus to some preventative work. We feel so strongly that, it's absolutely essential that we empower people with different abilities, people receiving services with the knowledge about sexuality, about violence prevention as a preventative measure. So we want to do that work. And we've already through the learning exchanges heard from providers what are some barriers in place in offering this education. So we kind of have some ideas of where to start. And then we want to identify long-term sustainable solutions. And we want the organization that we partner with, we want assistance with this. This is a pilot project, and we're right now already thinking of how we can sustain this because there is so much work that needs to be done, so much more work beyond just a couple of years. So that's kind of our path that we have started and where we continue to go. So now I'm going to go through the different highlights from the RFP. This is not all inclusive. Please be sure to read the full RFP for all of the details. I'm just pulling out some highlights here. So as I mentioned, the goals are to develop curriculum and resources for disability providers, domestic violence providers, and rape crisis programs, and also to co-facilitate provider trainings and ongoing technical assistance. The organization will collaborate with the OPDV project coordinator, which is me, and we are also hiring consultants with lived experience as a gender-based violence survivor with a developmental disability. We have already hired one consultant and we're looking to hire a couple more. So that will be the team that will be working together to develop the curriculum and the resources and to be providing the trainings as well. So we'll want to develop an initial training and curriculum for a series of 3 2-hour trainings for the developmental disabilities, so DD, domestic violence, DV, and our rape crisis program, RCP providers. And the training, everything that we do at OPDV, and so everything we do with this project aligns with survivor-centered, trauma-informed, and culturally responsive concepts. Some topics for the training, these have come directly from the learning exchanges. Information on gender-based violence, developmental disabilities, the social model of disability, risk factors that lead to high rates of victimization, potential barriers to accessing DV and SV services, ableism, reasonable accommodations to increase accessibility of domestic violence and sexual violence services. So after this initial training, we want to develop ongoing training. Now, while we have ideas already on some follow-up trainings that we think could be helpful, we also want these things to be developed organically. So we want to hear from providers during these initial trainings and afterward about what they think would be helpful, so that then we can develop 5 to 10 topic-specific webinars meeting the needs of the providers. We also want to provide initial and ongoing technical assistance for developmental disability providers. Examples would be a development of a resource guide about domestic violence and sexual violence services. I heard that in almost every single learning exchange for staff, and also in a plain language version for people receiving services. A risk assessment of violence tool. So something that I didn't mention that we are doing for in the project right now, that actually we're starting next week is our first session, is we're going around and we are mapping the intake process at developmental disability provider organizations and care coordinator organizations. We're interested in quite a few things, but one thing in particular is we're interested in exploring opportunities to screen for current and past domestic violence and sexual violence. And so we're hoping from some of these activities that it will help us develop these types of tools for providers. Conversation scripts. I've heard in quite a few learning exchanges that folks are not quite sure what they would even say if someone disclosed. And so it might look different depending on the person's position in the agency, but providing just what to say. I know it seems, but it can be rather intimidating for people who are not used to talking about this topic. And typically in developmental disability provider agencies, this is not a topic that's talked about a lot. So it can be really uncomfortable. And then we want to develop a model for annual staff training and support around the intersection of gender-based violence and disability. We want to do the same thing for the domestic violence and rape crisis programs, although that intervention will look a bit different. Some examples would be guidance on converting written materials to plain language and/or visual format. What I've heard from providers, domestic violence and rape crisis providers in these learning exchanges, is that they very much want to be able to support a survivor with a disability, and yet they feel frustrated because they do not have the resources or the training to feel confident in doing so. So the next bullet would be another example of this, like modifying policies and practices environment to increase accessibility. I think folks, agencies, organizations need assistance with this. So we'd like the project to provide that kind of help. And then a model for staff training around effective practices working with survivors with disabilities and the intersection of gender-based violence and disability. We want assistance developing a future plan for capacity building of this project. As I mentioned earlier, and we feel so strongly is needed, is we really want to equip developmental disability providers in offering sexuality education and violence prevention programming for people receiving services. We want to develop listening sessions for survivors with disabilities. In the learning exchanges I conducted with self-advocacy groups and people with disabilities and parents and family, there is a tremendous amount of lived experience. And I think that it would be incredibly important to get a group of survivors with disabilities together to have them share their stories and their experiences interacting with the different systems. What we also want to do is develop region-specific training. So different areas are going to have different issues and topics that will be more relevant to them. So for example, transportation could be is often a barrier anywhere for a survivor with a disability for a number of reasons. But if somebody lives in a rural area, well, transportation is going to pose a unique challenge and barrier. And so we might want to provide resources that are specific to certain areas and their needs. We also want to plan an annual networking event that brings all the providers together to collaborate. So the organization that consults with us will participate in advisory council meetings and implement the feedback provided. The project has an absolutely amazing advisory council made up of experts all throughout the state. We meet every 2 months, and they give a lot of great ideas and advice. They help with outreach. So the organization will join those meetings as well and attend any meetings as needed with the OPDV CDD team. The ideal bidder would have proven experience in both the developmental disability and domestic violence and rape crisis program systems and can demonstrate they are survivor-centered, trauma-informed, and culturally responsive. An ideal bidder should also have a robust understanding of the social model of disability and the complex intersection of gender-based violence and developmental disabilities. The contract resulting from the RFP will be for a period of 1 year. OPDV reserves the right to extend the contract for a second year. The contract will begin May 6, 2024. And I have to say, we are ready to go. We are going to start working on May 6th. And it will end no later than April 30th, 2025. Funding for these services will be up to $66,000 for each year for services outlined in the RFP. Any bidder, so here are the eligible bidders. Any bidder authorized to conduct business in the state of New York that can provide the services outlined in the RFP, has the ability to fulfill all the deliverables outlined in the RFP, which I'll go through in a moment, and has demonstrated experience in the creation of training curriculum, facilitation of training, and technical assistance for developmental disability providers and domestic violence and rape crisis program providers. Unfortunately, members of our advisory council, any organization as part of our advisory council, is not eligible to bid on the RFP, which we have listed in the RFP and we've talked about at council meetings as well. So now I'm going to go through the proposal content, submission, and evaluation. The proposal should be printed on 8.5 by 11 paper, should be numbered pages, no longer than 25 pages, single-sided, exclusive of the cover letter. And we actually got a question the other day about this, about the 25-page limit. So I just want to answer that question. The person was wondering if the attachments are included in the 25-page limit, and they are not. So no attachment is included in that 25-page limit. It's really just the technical proposal. And required documents, please have them in PDF format. The cover letter must include the person, so the content of the proposal is the cover letter. They must include the person who will be the primary point of contact handling the project, the technical proposal, proposed budget, required documentation. So non-collusive bidding certification, vendor responsibility, sexual harassment statement, Executive Order 177 certification, Executive Order 14, Executive Order 16, and gender-based violence and the workplace policy, if applicable. So if you have this policy, absolutely include it. We would love to see it. All of these forms can be found on the webpage for the RFP. So if you go to opdv.ny.gov, right on our homepage is a link to access all of the documents, and the full RFP is in there as well. So I'll go through now the components of the technical proposal. You can, it is worth a maximum of 80 points. Each criteria has a maximum amount of point value assigned to it that we will be scoring on a sliding scale. So for up to 3 points, you will get for following directions on proposal format, contents, and submission protocol. Next, for up to 8 points, experience and resumes of key personnel. So you're going to detail the personnel designated to provide training and technical assistance for gender-based violence providers and developmental disability providers. More on the personnel details, the name and title of each staff person, how many years each staff person has been providing training and technical assistance, and how long each person has worked for the applicant, and a brief description of each staff person's primary responsibilities. So again, up to 8 points for that. Next, you'll describe the relevant experience comparable to the services contemplated within the RFP for up to 10 points. Please attach a proposed work plan to meet the identified deliverables, up to 10 points. Include any relevant background and experience working with the DD and DV RCP provider community for up to 10 points. Demonstrate an understanding of how DD and DV RCP systems function in New York State for up to 5 points. a brief description of your experience implementing a staff training curriculum, including quantifiable and qualitative measures of success for up to 12 points. Demonstrate an understanding of the complex intersection of gender-based violence and disability and an understanding of the social model of disability. That we're going to be incorporating the social model of disability into a lot of the training. So it's really important that we can see that the organization that we are going to partner with has a really comprehensive understanding of that concept and how to apply it. So that will be up to 12 points. If the bidder is one of the following: certified women-owned small business, service disabled veteran-owned business, certified minority and women's business, or New York State small business, that is worth up to 4 points. If the bidder attests the organization has in place a gender-based violence in the workplace policy and provides a copy of the policy, you can have up to 3 points for that. And you can see OPDV's website for more information regarding these policies. Consistent with EO 190, where appropriate, in the response to this RFP, bidder must briefly describe how their proposal can improve community health and wellness through alignment and coordination with the New York State Prevention Agenda priorities and the WHO 8 domains of livability for up to 8 points, if you are able to do that. Bidders who score more than 40 points or more will be invited to give a presentation as the second phase of the procurement. If we have many bidders that score higher than 40, then we may choose the top 3. So those organizations then will be invited to give a training presentation to the OPDV team. This could be in person or virtual, and this is going to be worth 20 points. The organization that scores the highest on the presentation will be granted the award. And this is how the presentation will be scored. Again, on a sliding scale, so up to 7 points to demonstrate a mastery of training delivery, up to 6 points to describe how the RFP goals will be met, and up to 7 points to demonstrate an understanding of the intersection of gender-based violence and developmental disabilities through a survivor-centered, trauma-informed, and culturally responsive lens. The submission deadline. So all documents must be submitted to opdv.grp.info@opdv.ny.gov by no later than 4 p.m. Eastern Standard Time on April 9th, 2024. This is also the email address to send any questions by March 19th. So I just want to highlight some important dates. These are also on the second page of the RFP. Submission deadline for questions is March 19th. If you want to post any questions into the chat box during this webinar, that's perfectly okay. We will answer those questions along with the questions that were asked via the email address. We will be posting a response to questions by March 26, 2024. And the submission deadline to submit a proposal, to submit a bid, would be April 9th, 2024. And then the sample training presentation at OPDV offices or by virtual meeting will be April 16th, 18th, or 19th. We anticipate the notification of award to be April 29th, 2024, and the contract start will be May 6th. So again, you can post any question you have into the chat box. These questions will be answered at a later date, or you can certainly email any question you have to opdv.grp.info@opdv.ny.gov by March 19th, 2024. So thank you so much for joining this morning. We are done early, so you have 30 minutes left of your day, which I know is always appreciated. I really appreciate you all being here to learn more about this RFP. And I hope that if you feel that you'd be a good fit, that you submit a proposal. All right, thank you, everyone. I hope you have a wonderful day.